Hi, I'm Jenna Contreras, Director of Health Policy for the National Consumers League. I'm joined today by Nisa.
Hi everyone, I'm Issa Shafi, Associate Director of Health Policy at the National Consumers League.
So today we're going to be sharing with you important updates on the Script Your Future campaign. We're going to talk about a new focus on vaccine awareness and vaccine confidence. And we're going to focus on some ways that the medication adherence team challenge is going to look different in 2021. So the Script Your Future campaign is entering its 10th year, which is fantastic. Originally, it was designed to help consumers manage chronic diseases such as asthma, COPD, and diabetes. But as we recognize that low-income and minority communities suffer disproportionately from chronic diseases, we're adding a new emphasis on addressing health disparities as well. And we'd want to encourage the Team Challenge to focus on chronic diseases that they see most prevalent in their communities. So we're encouraging folks to go beyond this original list of chronic diseases, and we're hoping that throughout the year, we'll continue to provide additional resources for additional chronic diseases that we see being more prevalent in their communities. As well as this year, in light of COVID-19, we are focusing on vaccine confidence and adherence. And this is the most exciting update we have for you. So in light of the vaccine coming out during the same time as the National Team Challenge, we really thought that we should add this renewed focus on vaccine confidence, because we know that the campaign has traditionally focused on vaccine confidence for adult and child immunizations. But we're going to really need to, beef up the work on vaccine confidence for the COVID-19 vaccine. And we're also going to talk about how the Team Challenge is going to look different and how we're recognizing COVID-19 safety restrictions this year in the challenge and the reports. So why vaccine confidence? Again, pharmacists are poised to administer millions of COVID vaccines this year, in the coming year in 2021. And unfortunately, vaccine confidence has been hurt by the politicization of the pandemic during this year. And pharmacists are seen as the trusted source for information in many of their communities. So we think that pharmacists really are poised to be the ones to deliver that message of confidence in those communities. And what is vaccine confidence? So here we're going to start showing the resources, right? It really is fundamentally linked to how the perceived safety of vaccination, right? And different communities are going to have different perceptions of the safety of the vaccine. So you all are going to be in your communities, and you're going to see at what level vaccine confidence exists there and how you can have an impact on improving vaccine confidence. So what is it? It's really the trust that consumers have in recommended vaccines. It's the trust they have in the providers who administer the vaccines. It's a trust in the processes and the policies that lead to vaccine development and manufacturing. We also have to think about vaccine adherence in a different way, right? The COVID vaccine will require 2 doses. Patients will need to get the second dose later. The brand of the vaccines are not going to be interchangeable. Right now, there are 2 brands of vaccines that are up for approval by the FDA, and they're going to need to realize which one they're taking to follow up with the second one, right? So patients are going to need additional assistance and reminders to ensure that they follow through correctly. This is a safety issue. So we're here today to provide you some additional vaccine confidence resources. We want to make sure that we're providing them for all the limited English proficient communities that you're engaging with. So the first one is the COVID-19 fact sheets from the COVID-19 Health Literacy Project. All these materials are freely available for download. You literally can copy and paste all of this information and put it into your resources, into your talking points when you're doing your outreach. This really is something that's considered public domain. In fact, anything that's on a government website, such as the Centers for Disease Control or the Food and Drug Administration or Department of Health and Human Services, that's all considered public domain information. So there's no copyright infringement. You can literally just grab it and print it out and make it your own. A lot of the outreach that I've done in the communities and seen is folks just put their logo right on top of the information and share it with their communities. And because we're really seeing the linkage between COVID-19 and health disparities, we're adding, we wanted to emphasize the link and adding resources for you to focus on as well. And I will let Nisa take it over from here.
Thank you, Jet. So as Jet mentioned, we encourage teams to place a greater emphasis during the 2021 challenge on addressing health disparities. And a key strategy to addressing health disparities is to address health equity, which the pandemic has really illustrated how marginalized communities have been impacted disproportionately to the virus. With that, we wanted to share some resources developed by the American Medical Association regarding health literacy resources on inequities, and they are catered specifically towards non-English speakers. We wanted to remove some disparities around language barriers as well. And also resources on the impact that COVID-19 has had on minorities and marginalized communities, with the addition of state tracking information on COVID-19 race and ethnicity data. This will be helpful in your specific outreach in your communities as well. Additionally, we wanted to introduce resources developed by the COVID-19 Vaccine Education and Equity Project. It's a project that was launched with the objective of encouraging informed dialogue on addressing vaccine hesitancy. They have resources on addressing health disparities in the context of COVID-19 throughout racial and ethnic minorities, as well as resources for older Americans and COVID-19 and vaccine hesitancy in those population groups as well. Additionally, we wanted to introduce some resources on equitable allocation for the COVID-19 vaccine. The National Academies of Sciences has released a framework for equitable allocation that's been informed by our leading public health agencies. And this prioritizes populations and timeframes for how the vaccine will be allocated once it's released. There's some additional resources there for your consideration on what other advocates are doing in this space to prioritize equitable allocation as well. For vaccine education resources, we wanted to include some materials that could help inform your dialogue with patients regarding how vaccines work, what type of vaccines are available on the market currently, information on the upcoming mRNA vaccine, which is found in both of the leading contenders or candidates for the COVID-19 vaccine, as well as some general FAQs for COVID-19 in general that could help reduce or address vaccine hesitancy in your patient groups. And as for the team challenge, we wanted to update teams. A big part of the team challenge has always been direct patient counseling. For the past 10 years, we've really taken pride in how our teams have directly impacted patients with regard to their medication adherence. And because the situation is so, different at the moment, we want to emphasize that safety comes first. Please follow the local quarantine restrictions when planning your outreach. Consider the safety of your patients and the teams, your teammates. And team reports, we really request that you include clear descriptions of the quarantine restrictions in place in your communities. This will be really helpful to understand what kind of obstacles you've overcome to conduct the outreach that you have, as you will be evaluated on those metrics as well. When conducting outreach, please practice social distancing and wear proper personal protective equipment, such as masks or gloves or whatever is needed to safely conduct direct patient counseling or patient engagement. And for the adherence challenge itself, you'll be receiving materials to help bolster your campaign and outreach. These include medication wallet cards in a variety of languages, posters and stickers, and we really recommend making great use of the wallet cards. Patients really come to rely on them throughout the challenge. There are also customizable electronic materials for your use, which include templates for press releases, media advisories, and letters to the editor, as well as the PSA pitch guide. And finally, some important dates to remember regarding the Team Challenge. On December 18th of 2020, your letter of intent to participate in the challenge is due. Please make sure that you include all of the proper information that's required in the form. On February 1st through April 2nd, that's the time period of the Team Challenge. It's roughly 9 weeks. This is the time period where you'll be conducting most of your outreach. And on April 16th, that is when your final report is due to the National Consumers League. And teams will be notified of their status on during June 2021.
Thank you, Nisa, and thanks everybody for joining. We hope that this information is helpful, and we look forward to supporting you all in the Team Challenge 21. Thank you.